Greetings everyone, and thank you for joining us today. The following video discusses a major winter storm system, Winter Storm Uri, that was experienced in Texas from February 11th to February 20th, 2021, and explores its impact upon hospital operations during this cascading disaster. As noted, this presentation identifies various challenges resulting from freezing temperatures and the loss of utilities, as well as problems related to staffing, patient loads, and inadequate supplies. The video mentions visible gaps in emergency capabilities and also provides recommendations to mitigate future impacts and prepare for possible contingencies. Consequently, the goal of this presentation is to promote disaster resilience in hospital operations. An historic winter outbreak took place in Texas from February 11th to February 20th, 2021. According to the National Weather Service, a series of storm systems brought snow, sleet, and freezing rain to the entire state. However, it was the extreme temperatures that caused most of the havoc to residents, businesses, and government organizations alike. In some cases, temperatures plunged as much as 40 degrees below normal. The dip in temperatures and frigid weather lasted for days and resulted in several other complications. The power grid, managed by the Electric Reliability Council of Texas, or ERCOT, experienced a spike in demand coupled with an inability to operate under such dire circumstances. The loss of power in turn caused water systems to fail and pipes to break, which flooded roads, homes, and businesses. When all was said and done, 69% of Texas homes and businesses lost power, and 49% lost access to water. Hospitals also fell victim to the storm and lost power and water at a time when their services were needed most. This dynamic and cascading disaster resulted in a harrowing week for hospitals and medical personnel in Texas. So in this video, we're going to discuss several problems that were encountered, as well as actions taken to deal with COVID-19, staffing and patient discharge, traffic accidents, slips and falls and hypothermia, carbon monoxide poisonings, medical facility closings and dialysis, clinical and food supplies, loss of power, and loss of water. Hospitals in Texas were already very busy and perhaps even overwhelmed before Winter Storm Uri affected the state in February 2021. The response to COVID-19 had been underway for about a year by this time, and hospital staff had been working around the clock to address the needs of a high patient count. All workers were exhausted, and some people had left their professional roles as doctors and nurses because of the excessive demands placed upon them. Unfortunately, the workload for those who remained was about to increase, and hospital operations became even more complicated due to Winter Storm Uri. In anticipation of, or perhaps as a result of severe weather, hospitals looked closely at staffing and patient issues. Some hospital administrators looked at work schedules and took other measures to ensure employees could or would be available for their shifts. For instance, employees at Olney Hamilton Hospital in North Texas were asked to sleep at the facility in order to avoid being stranded at home and not able to commute to work. Numerous hospitals likewise canceled non-essential elective surgeries, and many patients were discharged before the storm arrived. For instance, 30 patients were moved out of St. David's South Austin Medical Center. Not everyone who was discharged had a safe way to leave or a warm place to go as the winter weather doubled down. David Huffstutler, president and CEO of St. David's Healthcare in Austin, noted that the challenges associated with the release of patients due to snow and ice on roads was challenging. Roberta Schwartz, executive vice president at Houston Methodist Hospital, mentioned that it was heart-wrenching to discharge patients since many of them lacked power. They therefore set up areas for patients to wait until they could be transported elsewhere. The release of patients was an important decision nevertheless, since the need for medical care was about to grow in dramatic ways. The icy roads created dangerous driving conditions, and the city of Austin alone had nearly 730 traffic accidents during the week of extreme weather. Numerous people slipped on the snow and ice, suffering broken bones that had to be treated by orthopedic surgeons. There were other instances where people were literally freezing due to the cold temperatures and loss of electricity, which was needed to heat their homes. Cases of hypothermia therefore placed an additional burden on medical personnel. Ambulance calls consequently rose 300% in some areas, and hospitals were the recipients of those requiring emergency medical care. In addition, after a roof of a nursing home collapsed near Lubbock, a hospital took in residents of that facility. Hospitals were some of the only operating medical care facilities during the storm. One of the biggest challenges for hospitals related to carbon monoxide poisonings. In an attempt to keep warm, some people lit charcoal grills in their home or sat in a running vehicle in their garage. More than 300 carbon monoxide poisoning cases were reported in Harris County, but the entire state witnessed the worst carbon monoxide poisoning exposure in U.S. history. Many of the 246 people who died in the storm were affected by carbon monoxide. This prompted Dr. Samuel Prater to state, "With that number of patients going in, it's turning into a mini mass casualty event." Making matters worse, hospitals were some of the only functioning medical facilities during the extreme winter outbreak. Countless medical clinics, pharmacies, physician offices, and dialysis centers shut down due to winter weather, road conditions, and loss of power and water. Roberta Schwartz, the executive vice president of Houston Methodist Hospital, said everyone who needed services from those places came to the hospital in record numbers. Most of the critical needs pertain to dialysis, however. In fact, 5 out of 6 patients that needed dialysis 3 times a week had no place to go. Hospital personnel therefore had to triage patient priorities. Ben Saldana, the medical director of Houston Methodist Emergency Departments, described the process of caring for these patients. Every hour we go into the waiting room and ask who is here for dialysis. Most of them raise their hands and we explain, this is what we're going to do. We're going to evaluate your blood work, EKG, chest x-ray, and decide if this is a life-threatening disorder at this moment, or is this something that we can treat you and get you dialysis in the next day. Another challenge pertained to clinical and food supplies. Some medical organizations, such as Tomball Healthcare, increased its periodic automatic replenishment levels just before the storm. But several hospitals faced shortages of critical items. Due to the icy roads, clinical and food supplies could not be delivered to the Heart of Texas Healthcare System Hospital in Brady, east of San Angelo. Carrie Williams, a spokesperson for the Texas Hospital Association, stated there was a lack of oxygen in many locations throughout the state. The shortage of this essential gas caused the mayor of San Antonio to send out a snowplow and request that state police help escort a liquid oxygen supplier to make needed deliveries. The Texas Restaurant Association recognized that hospitals were in serious need of food for their staff and patients and was working to provide those donations. The loss of power was likely the most significant obstacle facing many hospitals throughout the state. Most hospitals, according to Darrell Pyle, the chief executive officer of the Southeast Regional Advisory Council in Houston, were able to stay open because they had backup generators. Others received generators from FEMA, which allowed them to continue to serve their communities in spite of the community-wide loss of power. But even under these fortuitous circumstances, hospital operations were altered in unique ways. Some of the facilities could only power essential life-saving equipment, and heating was sacrificed in certain cases. Efforts therefore had to be made to keep patients comfortable with extra blankets. ABC News reported that power was lost at one hospital and the generator was not functioning properly. Therefore, 5,000 vaccine doses of the COVID-19 vaccine had to be administered quickly before the temperature for storage was impacted. The vaccines were provided to Harris County Jail, Methodist Hospital, Rice University, LBJ Hospital, and Ben Taub Hospital. The impact of the power outage and freezing water systems also jeopardized hospital operations in different ways. The loss of power and extremely cold temperatures shut down or inhibited the delivery of water to and within hospitals. External water sources were not available at times, and internal systems froze and experienced burst pipes, which flooded facilities. For example, Chambers Health in Anahuac outside of Houston lost water due to the storm and power outage. Obvious complications included the inability to wash hands, sterilize surgery equipment, or run dialysis machines. There was also no drinking water available in Dimmitt Regional Hospital in Carrizo Springs in South Texas. The lack of water in Tomball healthcare facilities rendered the fire suppression systems inoperable, which required facility-wide fire watch in the building. Because there was no running water in 2 hospitals in Austin, staff had to transport human waste in trash bags for disposal. The lack of water had a negative impact on hospitals in other ways, since water is needed to cool medical devices. Doug Lawson, CEO of St. Luke's Health in Houston, relayed that water is key to our ability to keep air flowing through our systems and to cool many of our medical devices. So when water is lost or we're not able to access a steady supply of water, services in the hospital can be impacted. Creative efforts had to be undertaken to address various problems associated with the lack of water. Many hospitals placed requests for additional bottles of water, and it was delivered if transportation could be secured and safely performed. HCA Healthcare ordered and obtained numerous 6,000-gallon tankers from Florida, North Carolina, and Colorado. Vintage Hospital in Houston also sought tankers and avoided a shutdown because the water was delivered in the nick of time. William Kiefer, CEO of Chambers Health, mentioned that clever staff pulled water out of a swimming pool in the wellness center to refill a 275-gallon storage tank so toilets could be flushed. Personnel at Houston Methodist Hospital also collected rainwater in laundry carts so toilets could be flushed. In other cases, engineers were contacted to address water pressure issues in hospitals, and lines had to be flushed to ensure water was clean once Winter Storm Uri dissipated. Overall, the diverse problems that affected hospitals were widespread. Don McBeath, the spokesperson for Torch, said the rural hospitals across Texas have faced similar challenges to urban hospitals with power outages, water stoppages, reduced or no food deliveries. All of these issues either shut down facilities or limited normal operations in serious ways. It is true that many hospitals in Texas give considerable attention to efforts towards emergency preparedness because of their frequent experience with hurricanes, tornadoes, and other hazards and subsequent disasters. However, Winter Storm Uri indicates that most have been too reliant on public utilities. According to Michael Wargrow, the vice president of HCA Healthcare, the loss of power illustrates the fragility of the Texas power grid and the need for emergency power sources. Hospitals are required to have an emergency power supply system according to NFPA 110, which includes the provision of power within 10 seconds for critical life support systems to the red power outlets in rooms. However, it's estimated that only 20% of hospitals have generators to run HVAC or heating, ventilation, and air conditioning systems. Winter Storm Uri also revealed insufficient capabilities relating to water, food, and other medical supplies. Furthermore, David Huffstutler at St. David's Hospital said no one hospital currently has the capacity to accept and transport a large number of patients if another one shuts down or is rendered inoperable. Others also acknowledged the grim lessons generated by the extreme winter weather in Texas in February of 2021. Carrie Williams of the Texas Hospital Association said there is unimaginable pressure on everyone, patients, staff, and families. They see and feel the desperation. Natasha Kathuria, a medical doctor, commented that we're overwhelmed, way more than we've been with COVID. The system failure has completely rocked us, she said. As can be seen from the information presented, there are a variety of issues that must be addressed to ensure that hospitals are better able to address extreme winter weather events in the future. This includes various aspects related to personnel, facilities, and operations. For instance, it's imperative that we ensure adequate and routine emergency staffing among administrators, doctors, nurses, and all other hospital personnel. We need to build capacity to house hospital staff in case of transportation is dangerous or delayed. We must identify cancellation procedures for elective surgeries and treatments. We need to implement discharge procedures earlier during winter weather and or be able to care for patients who cannot leave hospital facilities. We also need to anticipate a large number of patients that result from extreme winter weather events, such as accidents or hypothermia. We need to increase understanding of appropriate treatment of carbon monoxide poisonings. Implement triage processes to care for the most needy of dialysis patients. Store sufficient supplies of oxygen, food, and water, and streamline emergency orders as needed. We must develop necessary power capabilities, including generators and fuel, to run the hospital and address HVAC needs. It's imperative that hospitals obtain water systems and storage for all needs and operations, whether it's for drinking, fire suppression, waste remover, chillers, or medical devices. And they must explore ways to quickly obtain water from external sources. Hospitals should plan and prepare and undertake exercises for extreme weather events and all related contingencies. They must also hire qualified emergency management personnel who work closely with all relevant parties to get hospitals ready for these and other disaster scenarios. If these measures are taken, hospitals will be in a much better position to address similar disaster in future events. It's important to acknowledge that the dedicated efforts of employees to deal with this winter storm on top of COVID-19 is one of the most awe-inspiring things witnessed in hospitals in Texas. But there's ample opportunities to improve our hazard mitigation and preparedness measures in the future. As noted in the report, Managing the Storm After the Storm, Healthcare in Texas Recovers from Severe Winter Weather, experts encourage their peers in this sector to review your plans, establish contacts in advance of a crisis, and continue to share your lessons learned so that we can transition our experiences into lessons applied. David Callender, CEO of Memorial Hermann Healthcare System, also reminds policymakers, to our regulators, to people who manage resources, to those of us who provide services, that we must work as a team and make sure that this never happens again. Resilience is possible if hospitals take measures to plan and prepare.